Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. If you have cancer, you know someone who has cancer, or you smoke, you can't leave me now. You have to stick with the program till it's over so that you get a complete understanding of what is now known. I just completed a postgraduate certification program on acupuncture for treatment of the cancer patient at Memorial Sloan Kettering Cancer Center in New York. If you're not aware of what that is, it's America's premier cancer treatment and research center, and they have recently found out that acupuncture can not only assist in cancer's treatment, but is also an adjunctive primary cancer treatment. For many years, I've been treating patients who are battling cancer, undergoing chemo and adjunctive forms of therapy, and using acupuncture as a tool to help in the treatment of basically cancer treatment-related symptoms. Now, what this was that patients that are under treatment are frequently nauseous, and acupuncture helps to eliminate nauseousness. They frequently have no appetite, and acupuncture can increase their appetite. It was also used as a general tranquilizing agent to keep the patient calm and to aid in detoxification of the body. So it had always played an adjunctive role in the treatment, but wasn't primary in its treatment. What they find out through research recently is the fact that acupuncture assists in traditional treatment of cancer in a primary manner, treating primary symptoms, such as, number one, increasing a person's immune response, increasing endorphins, which are a hormone that tranquilizes the body and increases circulation and increases and promotes healing. It's also involved in decreasing swelling and edema, like in a case of a woman with breast cancer. They frequently have vascular problems develop in the upper extremities. They find that it aids in the direct treatment of that. It also helps with numerous digestive disorders associated with cancer, and also helps in the treatment of radiculopathy and neuropathy. That is, radiating nerve symptoms, pain, numbness, and tingling, which frequently occurs in the extremities as a direct result of the cancer or as a direct result of the cancer treatment. So these are primary treatment modes. So if you have cancer, you have to consider now acupuncture as a component in your treatment. It increases the efficacy of the treatment and increases your longevity and your ability to stay well, stay healthy, and maintain your overall sense of well-being. I'm chock full of statistics tonight because I just got certified in this program. It was the first round of certification for acupuncturists. So what happens is that patients will go into the city for treatment, and if they happen to live in the central New Jersey area, they'll come in for adjunctive acupuncture while they're undergoing their traditional treatment. Acupuncture in and of itself is not a known cure for cancer, but we find now that it has a complementary role that to date is unsurpassed as far as its adjunctive treatment. So you really have to consider it. It's cost effective. It really, really works and makes a major difference. We've made a lot of inroads in understanding cancer, and cancer isn't really just this, one word type of thing. It's a whole panacea of different disorders that deal with the abnormal growth and overgrowth of cells. And it can happen to practically any tissue of the body, and they may have their own particular aspects and forms. Some cancers are genetic, and we have a predisposition for that. Others can be occupational or environmentally related. You're exposed to toxins or poisons. Some are unknown, the cause of the cancer. But there's certain things, which we're going to address today here, that are known and that we can prevent and that can eliminate you getting the cancer at all. We're all going to come down with something sooner or later, but we need to eliminate this serious, serious condition. The goal with cancer, obviously, is to is the prevention of cancer by leading a good, healthy, wholesome lifestyle, and secondarily eliminating the known causes or carcinogens associated with our lifestyle. These are things that we're in control of. Early detection is another key thing. So if you're a person that, quote, hates doctors, hates getting exams, don't want to go for that annual checkup, don't under any circumstance want to have that colonoscopy done, don't want to go and have a chest x-ray, don't want to go and have blood work, well, right there, you're dramatically increasing your likelihood for failure if you do get a serious health consequence associated with cancer. So, in the midst of being at Sloan, what I came to realize as they put up all these statistics is that there's certain types of cancers that are treating very well nowadays. Breast cancer is treating very well. There's certain forms of cancer, there's certain skin cancers. If we can catch them in time, they're great treatment. Anything that doesn't have an opportunity to spread to different areas is certainly easier or is localized or is a local tumor. Colon cancer, it's getting a lot of attention because, if you can spot a problem very early on, we can remove it and, you can pretty much be done with it other than just being checked up with it. And now the sad news. The sad news is this, is that lung cancer is very, very serious. And the healing or cure rate or survival rate with having lung cancer is very poor. And the treatment of it to date is not great. In fact, the survival span of a person with lung cancer is no greater now than it was 40 years ago, even though we have much more knowledge and our arsenal of treatment is, greater than it had been. The results are no different. Now, we're going to address the smoking thing. And we all know that smoking's no good and you shouldn't smoke. And I realize with treating patients and helping patients to kick the smoking addiction, we like to call it a habit, but kicking the smoking addiction is that it's not an easy thing to do. The good thing is that not as many people are smoking now as used to smoke in the past. Basically about 7% less, and a lot of the high school kids are not smoking earlier now. So starting from 1987 up until recently, there's been a dramatic decrease, although 20% of all high school seniors are smoking or starting to smoke at that point. That's usually when smoking starts, is in and around that window, and then the badness just has a tendency of occurring from there. I can remember when I was a kid, you read on the side of the packet of the cigarette pack how the Surgeon General has determined that smoking may be bad for your health, and then gradually smoking may be associated with cancer, and then how smoking may be deleterious towards your unborn child. Basically, it's like this: smoking causes cancer, and if you smoke, you're going to get one form of cancer or another, and I'm going to give you the sad stuff in just a moment. Basically, 85% of all lung cancer is caused by cigarette smoking. The other portion can be occupationally related, and if we take a person that is worked with asbestos, if you worked with asbestos and you are a smoker, you have a 90 times increase in getting lung cancer than if you didn't have either one of those. So that's a pretty direct correlation right there. Sometimes people can get cancer as a congenital thing, but it's extremely rare and it's not the lion's share. So we're at this big focus of, don't get lung cancer or you might get lung cancer. Basically, lung cancer doesn't even get picked up until it's usually pretty bad. I mean, when you have a chest x-ray taken, catching it early may be good, but that is no time to rest assured that you're going to be cured because it's been detected. Basically, it's one of those things where, you just have to eliminate smoking at all. The amount that you smoke is not as important as the duration of time that you cigarette smoke. Basically, many times people that smoke, they say, well, I'm just a social smoker, or I only have a few cigarettes a day versus a pack or two a day. I'm not saying that more smoke isn't worse. However, the worst part of it is the duration that you cigarette smoke, not the amount that you smoke. So you have to eliminate the smoking, okay? Also, smoking low tar cigarettes, they find out, has no decrease at all in the likelihood that you're not going to get cancer. And the reason for that is people suck harder on the cigarette when they have low tar, low nicotine cigarettes. Also, what happens when they increase the tar and people suck harder, they also allow for the deleterious effects associated with the additional chemicals that they put into the tobacco. They have a greater toxic effect in the body. So what you smoke and the type of cigarette that you smoke is nothing that you should rest assured with in any way, shape, or form. Smoking is smoking, period. The duration is the duration, period. The whole thing of social smoking is kind of a goofy thing, because there is no such thing as social smoking. Actually, it's about the most antisocial thing you could possibly do. So this whole thing of eliminating it in all of the surroundings is absolutely valid and true. The reason is that the smoke that is gone goes into the air, not through the filter, is actually worse for you. It may not be as concentrated as if you're smoking it directly, but that form of smoke is more carcinogenic than it is through that amount of smoke coming through the cigarette itself. That's how come people that are not smokers are up in arms about the effects that are being caused. Side stream smoke, there's a 3 times likelihood that your child is going to develop asthma if there's a smoker in the house. There is a 3 times likelihood that your child is going to develop a serious respiratory disorder, and as far as ear infections or respiratory infections, lung infections, anything associated with that, because there's a smoker in the house, because it decreases your immune response and then increases the likelihood for asthma and all of those other things. Basically, 90% of all emphysema, that's another serious, debilitating, killing lung disorder, is caused by cigarette smoking. So, with these things in mind, you really have to consider it. I know that we covet the things that we like that we're addicted to, no matter what. And we can only explain the reasons why we could try to educate you on why you shouldn't do it. But I know that addiction is addiction, and since we covet what we like, we make excuses to continue on our behavior. Oh, or I'm under a lot of stress right now. I don't think that there's many cigarette smokers out there that don't think at some point they're going to stop smoking. In fact, if smoking was good, you'd probably be up to 4 or 5 packs already. But the thing is that, we hold this fallacy out because we want to continue the negative behavior. And there's just a lot of reinforcement that's associated. People use it to relax. They use it when they're under stress. They do it when they're driving. They do it when they're coughing, and endless reasons for why they want to smoke. The good thing is stopping smoking, and you're going to do that either on your own. You're going to use any of the myriad of over-the-counter things that are available nowadays, nicotine patches and things like that. Personally, I don't find there to be them to have a great degree of efficacy, and the reason for that is that whatever works, but the reason is that I find smoking ectomy is what you need to undergo. We need to cut out the smoking so that we don't have to cut out the cancer and then poison your body for the rest of your life. Now, what I use in the office to help people to stop smoking is this. One is clinical hypnosis. I've been doing it for 25 years. I've done over 5,000 people successfully for smoking alone. We have an 89% success rate. It takes roughly about 1 to 2 sessions. I can't guarantee that it's one. Most of the time, it's one session. Those sessions are single individual sessions, and they, help a person to eliminate smoking by using the power of the subconscious mind. Your body has a self-preservation protectionist mechanism within it, and your body doesn't want you to smoke, but your conscious waking mind, the part that wants to do what it wants to do when it wants to do it, always is overriding that. So we use the subconscious mind through this technique of medical hypnosis to override this desire to stop smoking. It's easy, it's cost effective, takes an hour. There's just you just have to just decide that, okay, I'm going to undergo this change. Do you have to believe in clinical hypnosis or hypnosis for it to work? Absolutely not. So that's one mechanism that you may want to consider in your quest to eliminate smoking. Secondarily is the use of acupuncture and acupuncture cessation and detoxification protocol that uses acupuncture and auricular medicine. There are acupuncture points that are in the pinna of the ear and in the distal portions of the hands and feet that we use, and we apply a mild electrical current. That treatment takes about 40 minutes per treatment. It has about an 84% success rate. The amount of treatments involved are anywhere in between 4 and 8 treatments, with the average being 6. Now, some of those people, they stop smoking as soon as we start doing acupuncture. And but on average, I've been doing it so long that I just, boom, let people know right away what to expect and what's on average. That technique is usually a gradual reduction technique, and the way in which it works is twofold. One is it decreases your desire for nicotine, and secondarily, it increases endorphins. They find that the endorphin hormone, the more of it is in your system, the better you feel, and the less stress there is in your system, and then the more you just naturally have a tendency of not wanting to smoke. So those are two techniques and protocols associated with stopping smoking that I want you to consider before we give you more bad news right now about the smoking. So we understand the lung thing. The lung thing is like, doesn't treat very well. Once you get it, it's not good prognosis. You know, you're going to be saying the long goodbye or the short goodbye once that diagnosis is made. But let me give you some other disturbing facts. Bladder cancer, 40% of all bladder cancer is caused as a direct result of smoking. That's not good. Cervical cancer, 1/3 of all cases of cervical cancer are caused as a direct result of smoking. Childhood respiratory ailments increase 6-fold. Diabetes, smoking decreases your body's ability to absorb insulin. So if you have diabetes in the family and you have a predisposition for diabetes in a congenital manner, you better not be smoking, because you're just going to go on the fast lane to being diabetic. Also, if you are diabetic and you're a smoker, it increases the circulation into your hands and feet. It can make you invalid by the time you expire. It can help to eliminate your ability to see. So you can go blind by that combination. So you might as well cut out the thing that is also leading you on the fast track towards becoming diabetic. The other thing is emphysema. As I mentioned, 85% of all deaths associated with emphysema. Here we go. Esophageal cancer. Darn, it's another really tough form of cancer to treat. 80% of all forms of esophageal cancer is caused as a direct result of cigarette smoking. Don't mean to be like a minor bird, but that's what I'm going to be here tonight. Fires. Fires are a direct result of, the most common cause of fires is cigarette smoking in the house. Now, I have kind of a sad story to take, not to get off the track a little bit. I had a patient that was with me for many years. She had a sad incident where she had burns over 80% of her body. She went in and after mowing the lawn, she brought her lawnmower into the shed and filled it up with gas. The fumes in there ignited the lawnmower, and she ignited the lawnmower up, and she got burns over the most of her body. She recovered from that. She recovered. She used to be a neighbor of mine. She recovered from that, and what happened was that her mate was a cigarette smoker and was smoking in bed one night, and they both died because of a fire caused by cigarette smoking. And you know what? They didn't even have any smoke alarms in the house. How could you go through that? If I got burns on my body, I'd be having a smoke alarm on my body all the time. I just can't understand, you know, that mentality. So fires increase dramatically as a result of smoking. Gastrointestinal cancer is doubled as a result of smoking. Ulcers are increased as a direct result of smoking. And the reason is because it changes the motility of the GI tract and keeps things stagnant and keeps the stomach acidic and causes it to eat up on itself. So it's a big cause of cancer. We don't normally associate heart attacks with smoking all that much, but this is what happens, is that you smoke and the arteries to the heart no longer have the ability to expand the way that they normally do. So what happens is that a person is a smoker and then they go to exert themselves doing some physical activity that's really not that strenuous. But what happens is that because the smoking doesn't allow the heart vessels to expand, it causes the heart to starve for oxygen and nutrients, and thus people get a heart attack. So we have that. People, this big thing nowadays with fighting the cholesterol, keeping the cholesterol low and keeping your high, your good cholesterol in balance. What they find is that smoking increases your bad cholesterol, smoking increases the cholesterol, and many times the same people that are smoking are also exercising and doing dietary stuff, and they want to be, and the doctors are trying to put them on medicine, when all they may need to do is stop the cigarette smoking. It's really, really critical. Now, all of you potentially expectant mothers, you know that, and I don't find that there's many women out there that are pregnant that are cigarette smoking anymore. It's almost passé. We know about the birth weight factor. What they don't go heavily on is that there is a tremendous correlation between a mental alertness, how smart your child is going to be. Intelligence quotient diminishes dramatically when the mother's a smoker. So who doesn't want a smart kid? It just doesn't make any sense at all. Now, we know from my previous shows that a big percentage of my practice deals with infertility and acupuncture and Chinese medicine for the treatment of infertility. Do you know that couples in which at least one member, now this isn't confined to just the woman, in which one member smokes are more than 3 times as likely to have trouble conceiving than non-smoking couples. It's right there. So, you need to do that. You work so hard and your hearts and desires are to have that miracle child. Well, smoking can't be a component of either one of your lifestyles. You have to eliminate it. Kidney cancer. 40% of all cancers related to the kidney are caused as a direct result of smoking. We're taking all these percentages and we're adding them up, and all of these different types of cancers, and boy, it just is not looking good. Laryngeal cancer. Smokers who smoke 25 cigarettes a day have a 25 to 30 times likelihood of developing cancer of the larynx. Throat cancer just goes right through the roof. In fact, there's really not much throat cancer at all that's non-associated with smoking, or unless we want to throw it in with chewing tobacco or cigar smoking. But laryngeal cancer we're on to now. Okay, here we have mouth cancer. In mouth cancer, there's a 27 times increase in mouth cancer for smokers than non-smokers. Every time I go to the dentist now, he's doing this oral cancer thing, running his finger around like that. There's a 27 times more likelihood for throat cancer. I've never seen so much periodontal work going on recently. Within the past few years as there is now. Tooth decay is pretty rare nowadays. We have great better brushing habits. They have better tooth care, better toothpaste with fluoride and all of these things. But so periodontal disease and disorder, is, dramatically rising, so the teeth aren't bad. So the dentists aren't getting your hard-earned money, but the periodontist is. Because if you're a smoker, there's like a 300 times likelihood that you're going to be, or 3 times greater chance of periodontal disease and disorders if you're a smoker, because it just affects that type of tissue. It decreases the circulation, increases the immune response, puts all kinds of bad chemicals and chemistry in there. So, if you want to avoid the periodontist and save yourself some time, energy, money, with all those gum resections and things like that, you better stop smoking. I think, I'm only on the second page. I bought 50 pages of notes to go over here today. So I could go on with 20 of our shows before I'm going to get through these 50 pages. So I'm not even done with 2 of the pages. I can't believe this. Okay, osteoporosis in women. There's a threefold increase of osteoporosis in women that smoke versus women that don't smoke. There is, and I'll explain that in just a second, and there's also an increase in back pain in smokers versus non-smokers. There is a non-healing of back disorders in smokers that's a threefold versus non-smokers. There's more osteoarthritis and degenerative joint problems of the back in smokers versus non-smokers. Why is that? Because going to the vertebra and to the discs of the back are something called nutrient arteries. These nutrient arteries are very small. They're about the size of a pencil width, the lead inside of a pencil. That's what brings the nutrition into the discs of your back and into the spine of your back. And what happens is that since atherosclerosis and this constriction of the vessels of the blood supply is there, what happens is that it closes these down, so these areas, these vital areas, are starved in the nutrition, so then they degenerate, just like putting the fruit withering on the vine. We have the spine and your nerves and the discs of your back withering on the vine. So if you get it. If you're having back surgery or any form of surgery, your ability to heal and your ability and risk of infection diminishes dramatically, okay? So I want you to keep this in mind. We'll pick up on this, and don't worry, we're not going to go through the remaining 50 pages. For Natural Healthcare Alternative, I'm Dr. James R. Golding, and thank you for watching.